Hello, my name is Chris Atto and I am Head of Research and Development at Maudsley Learning, working as part of South London the Maudsley NHS Foundation Trust. We're a big mental health trust based in South London. The project that I'd like to tell you a bit about today is called the Accept project, and it was funded by Health Education England and delivered by colleagues here at SLAM, so mainly from Maudsley Learning and from the Estia Centre, two of our amazing teams, as well as in collaboration with colleagues from Autistica and from the National Autistic Society, as well as being helped by a range of other great people and organisations throughout our journey. So I'm going to take a few minutes just to tell you a bit about what the project aimed to achieve, what we actually did, and then what we found. So to start with the aims. There were four main aims, the first of which was to scope all around the country and understand what training is currently being delivered that relates to autism and improving the lives of people who are autistic. The second of those was to think about how it mapped to the core capability framework for supporting autistic people. So a guidance document out there that we'll say a little bit more about in a minute. Thirdly, to think about what gaps we could identify and see where there might be areas that we could improve practice or improve the provision of training. And fourthly, thinking about pulling all of that together into a directory that showed where all of this training was available, as well as a few other guidance documents to help people make the most of the findings from our project, including videos such as this. So with those being our main aims, I'll tell you a little bit about what we actually did. So there were 5 things that we undertook to do as part of this project to try and meet those aims. The first of those was to do a national survey that we were fortunate enough to have nearly 400 people respond to. And we asked people who are either an autistic person, family member or carer, someone who is a trainer who delivers autism training, or people who work with autistic people in their day-to-day roles from any background. Of course, some people could complete the survey multiple times as members of more than one of those 3 groups. Secondly, we did a whole range of interviews with individuals and focus groups with small groups of people to ask them more information about their experiences. At the same time, we undertook a big scoping exercise where we spoke to nearly 200 organisations who provide autism training to understand a little bit more about what they provide and to gain some of that information to include in our documents. Fourthly, we undertook a systematic review of the literature. So that means looking out there to see what evidence has been published, what papers people have written up and shared in the public domain that are able to give us evidence about training to do with autism. And then lastly, we did a Delphi study, which is something where we went out to a group of experts in a particular area. So in this instance, it was people who are trained in cognitive behavioural therapy. And we asked those people about their views on training relating to autism. So those 5 things are the main parts of the project that we undertook. And at the same time, all of that was underpinned by communicating across the country with a whole range of different organisations and trying to assess and pull together all of that data that we found. So the last thing I'd like to tell you a bit about is the findings from the project. And we think there are some really important findings, some interesting outcomes, and some important recommendations for us to be able to share with people. Firstly, overall, we found that trainers working with autism training are aware and are using the core capability framework, which is really positive. We did, however, find that there was room for improvement in people's general awareness of the core capabilities framework and how much they could use it. Although throughout the project, we did see an increase in this and people saying that having found out about the core capabilities framework, they're very interested to use it more often. However, we also came across some barriers that people experienced. Firstly, there were barriers to people with autism getting involved in training. That was to do with stigma towards autistic people, stigma towards people accessing training, and also people being unsure of how to get involved or how to support people to be involved. We also came across some barriers for healthcare professionals in their understanding of the importance of autism training, their ability to find and access what training is out there, and also maybe again stigma and the ability for people to be released to be able to access that training and bring it back to improve their workplace. We also found some interesting findings relating to the COVID-19 pandemic and changes that might have taken place to autism training during this time. Those related to people mostly being able to move training online and the adjustments and changes they needed to make to their training to make it accessible both to healthcare professionals, but also to people with autism and their families and carers. Really importantly, the project found some gaps in current provision and current practice relating to autism training that is very, very important to highlight. And you can find more in the full gap analysis report that is attached to this video and available on our website. Notably, there were gaps in provision around specialist training, so people who work in specialist areas of, for example, healthcare that need autism training that is adapted to their workplace, which was a very interesting finding. We also found that there were some gaps in consistent and respectful and non-stigmatized uses of language and the terminology that people choose to use. So again, maybe an area for us to be able to improve. We also noticed a gap in evaluation and the use of data and evidence in delivering training to be able to improve that training and understand the impact it is having. And we also found, unfortunately, a gap in the amount of opportunity there was for co-production and for the opportunity to involve experts by experience in this training. So all of these findings led us to some interesting recommendations about the project. To pick out a few of those, and again, the full list of these is available in the final project report that is available on our website. We found that there needs to be more awareness of the core capabilities framework and of the autism training that is available and out there, and hopefully our repository and directory goes some way towards doing that. And as a result, we also need more communications, more chance to talk about this kind of training and give people the availability and options they might have. Secondly, it's clear that there's a need for further involvement of autistic people in the development and delivery of autism training. And that means increasing the opportunities for them to be involved, doing that in a way that encourages and supports people and allows people to feel valued and supported in getting involved in those kind of activities, and also in the people that are involved in autism training who aren't experts by experience, really understanding the value and importance of working in that way. Thirdly, we found a lack of evidence and the need for more research and evaluation around what works in delivering autism training, both the design and the delivery and the follow-up from that, and also in making sure that we're able to harness relevant evidence from the surrounding field to be able to integrate that into the approaches that we have to training to make sure they can have as big an impact as possible. And also people talking about the approaches that they're taking to evaluation and research so that we can share, practice and learn from each other. And finally, we found it was important for people to think about incentivizing the use of the core capabilities framework. How are we encouraging people to use it? What is the benefit and the reward for them doing that? And there were suggestions made such as being able to use an accreditation scheme where people can be really clear that their work is mapped to the core capabilities framework, which shows a certain level of quality. So, as I said, there's a huge amount of findings and a huge amount of work that's gone on in this project. We'd really encourage you to look at our website to be able to look at the various different documents we've created that hopefully will be useful to you in your practice, to other people you work with or other people you know in your network. So please do share and spread the message. And that's a really, really important outcome from this project that we hope to continue. People's awareness of autism training and their interest in getting involved in it in one of very many different ways. So thank you for your time, and I hope you enjoyed hearing a bit about our project.